Good afternoon, I'm Milton Walker with the Midday News. Could healthcare practitioners be allowed by law to issue contraceptives to underage patients? That's a recommendation of the Child Development Agency, which also wants to make mandatory for more professionals to report suspected cases of child abuse. The recommendations were tabled at a parliamentary committee meeting yesterday. Krista Campbell explains.
Currently, teachers and those in the medical profession are required by law to report if they suspect a child they come across is being abused. But now the Child Development Agency, CDA, wants to broaden the list to include
ministers of religion, attorneys, members of the JCF, coaches and community workers that work more closely with children.
Once that recommendation is put into law, it will become mandatory for these professionals to report suspected or known cases of child abuse. Failure to do so will result in a fine not exceeding $500,000, 6 months imprisonment, or both. The CDA says it's finding that a lot of healthcare professionals are afraid to act on this law in its entirety, but the CDA insists it's important in getting more children out of abusive situations.
In distress, some persons feel that their sole responsibility is to make the report and thereafter nothing further. So we are saying that if you're in a school setting and a child has been abused, you have made that report. If the child needs medical attention, for example, your duty of care should follow through to see that the child actually gets that attention.
Committee members agree.
Once a physician undertakes his task of reporting it to the relevant authority, then if the child continues to be in that situation, then the physician should not be punished for providing contraceptives to that child. And if my understanding is correct, Chairman, I have to say that I give full support to that.
But in order for the authorities to increase the reporting of child abuse, the CDA says the current systems must be improved. The CDA wants a multi-agency intervention for children considered to be high-risk cases, and so it's also recommending a timeline for the Office of the Children's Registry to process each report for the necessary investigations to begin more quickly.
If you make a call to the registry to say that a child is in imminent danger for whatever reason, that goes through pretty much the same kind of processing mechanism. As a matter of fact, we've even seen situations where a report may be made to the police or some other entity, and the reporter is told, well, first you have to go through the registry. So we're suggesting, as part of the administrative support, that there should be a specific emergency response mechanism. We're suggesting some kind of rubric that identifies clearly the difference between a child in need of care and protection, which ought rightly to go to the CDA, and other types of cases which can be referred elsewhere.
Even in a situation where children may report to the CDA, I also much rather the children know that they have an independent arm who answers to no ministry that they report to. And I think that is what will make the system work.
Krista Campbell, TVJ News.
Meanwhile, the Child Development Agency has expressed concern about an increasing number of children with substance and alcohol abuse issues. At Tuesday's parliamentary committee meeting, the CDA made recommendations for the law to be changed to better protect children involved in the illicit activity.
When it comes to tobacco and intoxicating or addictive substances, moving the prohibition from just selling to any type of distribution and expanding the prohibition to cover other types of addictive substances from those, including marijuana.
And the CDA is also calling for persons found in custody of a child who has been the victim of human trafficking to be penalized.
In relation to child trafficking, the first wouldn't change the law much, just updating the definition under the CCPA to match the definition under the Trafficking in Persons Act. But in addition to that, we felt that the law could be strengthened where the victim of trafficking is a child, to ensure that even having custody of a child who has been trafficked can give rise to criminal penalty.
A 37-year-old man died this morning in hospital from injuries he sustained after being hit by a motor vehicle on Denby Crescent in Clarendon yesterday evening. He is Kennedy Rose, otherwise known as Jet Lee. Reports indicate that shortly after 6 o'clock, Mr. Rose was standing at the gate of a shop in the community when he was hit by a Toyota Fortuner. He was taken to hospital where he died while being treated. Residents who witnessed the incident say the driver of the car was speeding. A shop owner who witnessed the incident gave her account of what happened.
I saw Jet Li step off my shop taser and went on the side of the corridor. And I saw when the van was coming up. And I noticed his mom was right there as well. And when Jet Li came up, when Jet Li came at the sides, immediately the van came up and it swung from my shop and went and hit Jet Li. And I cried out.
His mother, who was at the scene, recounted the moments leading up to her son's death.
Me not come from down that way down the road there. And he car passed me down there, so pan a speed coming up. Cause when the car come up and his speed coming up, me just jar it at the road and give it pass. I'm saying this man I drive like a madman, so. And by me down there, so take time while coming up. Mary, the car run now and gate and lick it down. And Mary, the guy them and say, whoa, then kill Jet Li.
The driver of the Toyota Fortuner is being questioned by the police. Several health workers who yesterday staged peaceful protests against the non-renewal of contracts for some of their colleagues are back on the job. However, their union has warned that the work resumption could be short-lived. The workers who are attached to the Northeast Regional Health Authority gathered with placards outside the St. Anne's Bay Hospital, the Annotto Bay and Port Maria hospitals. With over 30 workers affected, the Assistant Island Supervisor of the National Workers Union, Leonard Sewell, says the matter needs to be rectified soon.
It is a regional issue, and let me say for the record, we have not seen this in other regions. It's only in Northeast Regional Health Authority this is taking place. And for my over 20 years as a union rep, it is the first time I've seen something so wide scale. And there's scant regard as it relates to the Labour Relation Code and the rights of the employee and even the staff order.
A worker at the hospital who wants the government to intervene in the dispute says the needs of the workers should be considered.
We are here protesting, hoping that the government will do something to these and even to consider the different needs that they may have, observing that they are with children, and even to support children in these times without a job. It is ever so very difficult.
Effective yesterday, Jamaicans can now access their medical information through a medical database offered by Advanced Integrated Systems, AIS, to insurance companies. The system was launched yesterday morning. It allows the sharing of medical data between doctors and patients, as well as a prescription information. The system is also expected to reduce waiting time in both public and private health facilities. About that, you didn't hear from Douglas Halsall. Health Minister Dr. Christopher Tufton says these systems will go a long way as the government tries to develop a national health insurance scheme. The head of the police operations in Clarendon, Superintendent David White, is reporting good news for the parish. In an interview with TVJ News, Superintendent White said the police are witnessing some success where crime is concerned.
We are looking at least right now for Clarendon a 25% reduction in crime in comparison to last year. And, you know, murder is one of those things that we would have seen some decrease in. We yet to continue our effort to make sure that Clarendon is one of those safe places.
Head of the Kingston West Police Acting Senior Superintendent Howard Chambers says investigators remain uncertain of what has led to the spate of shootings in the division. Several persons were killed last week. More than 15 persons have shot between Thursday and Saturday.
Yes, that's also gang related, and that's the south side of the division. Another situation they're affecting us. Pretty much right now we are putting in as much as possible containment effort, and so we increase the amount of patrols in the area with support from Mobile Reserve and JDF.
Head of the Predial Larceny Prevention Unit, Deputy Superintendent Kevin Francis is warning butchers to be vigilant and genuine with their purchases of meat. This warning was issued as the police continue to clamp down on farm thieves and butchers selling meat unfit for consumption.
Progesterones and all these different chemicals are in the system of the animal. The meat is not ready for consumption. And it can cause poisoning, different types of diseases, and all these things. When persons are turning up at the hospitals with different ailments and they cannot find what the problem is, we are not aware if these are not some of the causes.
DSP Francis also warned the public to be careful of stolen fruits and vegetables, as they too can be poisonous. He was speaking at the annual Butchers Seminar in St. James about do's and don'ts of the meat trade in Jamaica on Monday. All that later, 9:30 tonight on TVJ. And that's the Midday News. I'm Milton Walker. Join us at 7 for Primetime News on behalf of the News, Sports and Production team. Good afternoon.